I do see all of our lovely panelists now, so we can go ahead and get started early with this panel and then maybe have more time for questions at the end if y'all have questions and then make up some of that time. So it's a great problem to have. So first off, I'm going to introduce our wonderful moderator, Matt Jewett. So I'm super excited to introduce Matt Jewett of Children's Action Alliance. He'll be moderating this first panel on oral health advocacy at the national level. Matt Jewett returned to the role of Director of Health Policy at Children's Action Alliance in March of 2023, having previously worked at Children's Action Alliance as a research associate from 2004 to 2013. So his CAAOG. At Children's Action Alliance, he has led outreach campaigns that increased access in kids' care health insurance enrollment. He previously also oversaw grants for Mountain Park Health Center from 2013 to 2023, managing up to $35 million a year in grant funds, including for the construction of a new clinic. He's also a graduate of the University of Arizona and has studied graduate level public health at A.T. Still University. Enjoys a good cup of tea, growing his vinyl collection, and exploring his home state of Arizona and the world, and also my former supervisor. So super happy to have Matt here. Before we start with the panel, and Matt will introduce the panelists, I'm going to launch a quick poll for you all to engage with, and then Matt can take it away. All right, I'm seeing about half of you have never taken action at the federal level. About half have taken it in the past year. That's great to see. And then some have taken action, but been longer than a year. All right, looks like actually more people have taken action this year or at some point. That's amazing to see. Some don't remember. All right. Awesome. All right, Matt, I will let you take it away.
Thanks, Brianna. And I want to say thank you to all of those involved in planning and running the conference today. I know how difficult it can be, especially to run a virtual conference. And thank you all for being with us and spending the second half of your Friday, if it's the second half of your Friday with us today. I apologize if I am coughing. I will try to mute myself. Allergies and maybe a little bit of a lingering cold. And also looking at myself in that box, I realized, well, it's a Fun Friday shirt. It's not the kind of one that they tell you to wear on television. And I guess that goes to a Zoom meeting. So if I look kind of crazy there and the screen starts doing things, I do apologize. Those of us who are here today know the importance of oral health to our overall health. Yet dental care is the health service people are most likely to skip due to cost. And tremendous disparities remain in who gets oral health care, with lower income, rural, and Black, Indigenous, and people of color communities often left out. Yet, according to Families USA, from 2020 to 2022, nearly half of states expanded their Medicaid adult dental benefit. Arizona is not yet one of those states, although late last decade, we did restore the emergency dental benefits in Access, our Medicaid system. And we have had some success trying to push through a bill in the legislature, although it has not made it to final stages. But we have certainly made some headway in trying to get a comprehensive oral health benefit under Access for adults. On a federal level, there's also a push to expand dental benefits in the health insurance marketplace that we'll talk about and in Medicare. None of this happens, though, without advocates raising their voices to show the importance of oral health in keeping people healthy. So together, our actions and our advocacy are building a bridge to better health. I will introduce our panelists now. First is Dr. Lisa Simon, who was practicing dentistry in a federally qualified health center, which is what I did for the 10 years I was away from Children's Action Alliance, not the practicing dentistry, but working in an FQHC overseeing grants. When she decided to apply to medical school to better care for her patients. She's now a physician, dentist, and health services researcher who has published more than 70 peer-reviewed articles on the separation of medicine and dentistry, and has advised federal and state policymakers nationwide on oral health policy. She's a faculty member at Harvard Medical School and Brigham and Women's Hospital, where she also practices primary care. Kasey Wilson is a senior policy analyst at Community Catalyst, where her work focuses on federal and state policy opportunities to improve coverage, affordability, and accessibility of dental care. Kasey offers policy expertise and technical assistance to state and local advocates, policymakers, and other oral health stakeholders related to community-centered and equity-informed policy. And Frances Walsh is a seasoned advocate and dedicated champion of community well-being and health equity. With a master's in public health from UCLA and a long background in supporting networks for social change, Frances leads transformative initiatives throughout the nation aimed at advancing health equity through collective impact. Currently serving as a strategic advisor for the Oral Health Progress and Equity Network, or OPEN, Frances brings over a decade of experience in collaborative design and advocacy for strategic change at the local, state, and national level. Thank you, panelists, for joining us. I will throw out the first question, and we'll see who wants to answer first. What changes or opportunities to advance access to dental care have you seen at the national or federal level? I kind of queued that up, but help us flesh that out. Who wants to go first?
I'm happy to go first. We might as well get this conversation going. Hi, everyone. It's so nice to be here with you all today. And for the other panelists and for Matt, thank you so much for the introduction. I'm so delighted to get to learn with you all. I think we're going to see a broad range of responses from the panelists, and I look forward to hearing from them. So I'm going to pick one that I'm most excited about, which is the possibility of a Medicare dental benefit. As many of you probably know, Medicare since 1965 has had an explicit exclusion written into the Social Security Act that means that Medicare can't pay for any dental benefits. Right now, only about 50% of adults with Medicare actually see a dentist every year. When they do, they spend more than $1,000 out of pocket. Medicare Advantage is a privatized Medicare program, which is becoming increasingly popular. Now about 50% of people are in Medicare Advantage, and about 98% of those plans actually have a dental benefit, and they are the most heavily advertised part of these plans, often leading people to enroll in them. But if you look at the outcomes, people are unlikely to go to a dentist. They actually have the same numbers as people in traditional Medicare. So clearly this privatized program is not the answer either. So we're really stuck because Medicare can't cover dental benefits, and this Medicare Advantage plan isn't offering them. In the midst of this total absence of care for older adults and people with disabilities, over the last 2 years, the Center for Medicaid and Medicare Services has sort of secretly snuck into the annual physician fee schedule, which sort of describes all the benefits that Medicare offers, a small Medicare dental benefit that has started to apply to a number of people with specific health conditions. This includes anyone receiving chemotherapy, people receiving IV bisphosphonates, people getting CAR T therapy, people undergoing organ transplant or a cardiac valve procedure, and people with head and neck cancer. Of course, this is a really small number of people compared to the overall 65 million Americans who are on Medicare, but this is the first time that Medicare has ever done something like this. Not to mention that if you or anyone you know works with patients who have these conditions, this is a real game changer for them and will really increase their health. On a larger level, we still are stuck with this law that hasn't changed since 1965. And just this week, Senator Sanders is announcing the release of a new Comprehensive Dental Reform Act bill, which would include a Medicare dental benefit in addition to lots of other changes. So I think that's a really exciting and very topical policy change that we could talk about today too.
Well, I'll jump in and plus one the legislation that Dr. Simon just mentioned, and we'll also just brag on her a little bit because there was also a Senate committee hearing yesterday that Dr. Simon was a part of. So if you didn't see it and you can access the recording and watch it, I would encourage you to, because there was a lot of powerful statements made, and Dr. Simon's testimony was really, really powerful in particular, I think, both on the Medicare front and also on the Medicaid front, which is a piece that I feel particularly excited about, a little bit different than Medicare, as I think you all know. Medicaid can pay for some dental services, but it's optional. And so we know that states have made really good progress, especially over the last several years. We've seen a lot of states add dental benefits, extend benefits. And there are opportunities also at the federal level to add adult dental as a mandatory coverage category. We know that the optional nature of these benefits means that there's a ton of state-by-state variability. We know that people's access to care needs and oral health needs don't abide by the boundaries of where their state starts and another state ends. And so it could be the difference of moving just one state over and having completely different benefits or no benefit at all. So this legislation would also make Medicaid adult dental benefits a mandatory coverage category. It's not the only vehicle for that. There have been other federal opportunities to do that. The Medicaid Dental Benefit Act that has been introduced over the last couple of sessions is another opportunity. And I'll also lift up that there are some opportunities at the federal level to support dental therapy. I know Arizona does have a dental therapy law in place. And so another thing that this particular piece of legislation did, but again, it's not the only vehicle for, is adding dental therapists to the National Health Service Corps. It's the largest dedicated source of funding for scholarships and loan repayments for primary care providers working in underserved communities. We know that dental therapists disproportionately work in underserved communities, and so making them eligible to access these funds can really make dental therapy education more accessible. We know that diversifying the oral health workforce is also a really important part of the puzzle. There are also opportunities to include dental therapy programs and trainees in HRSA's oral health training programs. Again, these are the main source of federal funding for dental education programs, and so making them available to dental therapists and also increasing funding, because even currently we know that demand for those funds outstrips the availability of them. And then lastly, I'll just note one other opportunity that is really salient right now, which is the 2025 Notice of Benefit and Payment Parameters. It's a large rule that gets released every year that lays out regulations for insurance plans sold on the private marketplace. And this year included an update to allow states to include adult dental services as part of their essential health benefits packages, the list of services that most private insurance plans in the state are required to cover. This was previously prohibited, so there were regulations that meant that states could not include adult dental services, even if they wanted to, as part of their EHB packages. So states had a lot of flexibility, but this wasn't part of it. And now it is. So that's a really exciting opportunity. There are a lot of moving parts, and state action is required to make it happen. But it is an exciting opportunity. We have resources that we can share about that if folks are interested. And I will stop there.
Kasey, can I ask a quick follow-up question on that? Is there any data showing how many people might benefit from that new rule that would allow, let's say, if all 50 states took advantage of making adult dental an essential health benefit in the marketplace, what might that mean?
Yeah, that's a great question. I wish I could say a number off the top of my head. I cannot.
Sorry.
Maybe Dr. Simon can.
I'm not a robot. Please tell me, Lisa, everyone. I'm no robot. I only know this because I looked this up, anticipating possibly some questions yesterday, because the exchanges have actually had a real boom. Last time I'd sort of dug into this was in the 2015 to 2020 era, where there was some concerns they were shrinking. But now more and more people are using it. About 22 million people bought insurance on the healthcare exchanges nationwide this year. So if we imagine 22 million people buying dental insurance, that's pretty amazing. Even if it's half of that, that's 10 million more people going to the dentist, which is pretty cool.
That's awesome. I think in Arizona, we're in the 300s of thousands, and about 45,000 of them are children. Sorry, I know I'm not a panelist, but I think that's really awesome, because
you're even better. You're like the or panelist who's like keeping us on track.
Thank you. So I do want to keep up with that question, though, of what changes and opportunities to advance access to dental care have you seen at the national and federal level? And I know, Frances, we have not heard from you yet.
Thank you. Yeah, so I really want to tell folks about OPEN, the Oral Health Progress and Equity Network, and I do see some familiar names, which is wonderful. But if those of you who are not familiar with OPEN, it's a national network of folks that are in all 50 states that are aligned around equitable access to oral health care. We have a focus on lifting up. We have not only state representatives, but also grassroots representatives in almost all 50 states. And we really do focus on lifting up the voice of the grassroots representative and amplifying those perspectives to advance our work. So OPEN as a national network with folks coming together, there's a wide range of activities that are continuously going on. And so in terms of advancing access, one of the things that I've seen, and I think it's kind of one of the more interesting ways that the network comes together, but we have some special interests groups. And so back in 2022, the Rural Network Response Team, this was a group of folks that were all dedicated to advancing rural oral health access, but they had a series of virtual roundtables. And so they wanted to hear from folks all around the country about the post-pandemic reality. And so there were a couple of states that had offered a comparison. So we had Pennsylvania on one side, who had passed and implemented teledentistry prior to the pandemic. And then there were some states that had allowed for teledentistry through the pandemic. So South Carolina had some representatives there in a panel discussing the differences between South Carolina and Pennsylvania, not only, since the pandemic, before pandemic, with what was happening in Pennsylvania, and really being able to focus not only on improving access, but also working to demonstrate to improve outcomes as well, or to demonstrate improve outcomes. Another thing that OPEN does, that's typically on an annual basis, there's typically a annual advocacy campaign, and about every other year we'll do a Capitol Hill Day. And so that's where folks in all 50 states are encouraged to meet with the representatives, and the entire network will come together to deliberate over what are the primary policy asks that we want to make of Congress as a unified front, right? With speaking with one voice, so to speak. And so those will go through the whole network consensus process, but typically we'll have 3 federal policy asks. And so that's something that folks will take to their legislators. And I do want to share, last year, we had some great success with the Heads Up Act, which was one of the policies that we had advocated for. If you're not familiar with it, the Heads Up Act, that will designate people with intellectual and developmental disabilities as a medically underserved population by HRSA. And so since that advocacy day, there has been a tremendous amount of movement on the Heads Up Act at the national level, as well as some states really moving that forward and making sure that designation is included. So I just can't speak about OPEN enough, and really to encourage you all to join. And I'll include in the chat ways that you can do that and continue to tell you more about it as we go along. So thank you.
That is awesome. Thank you. So how does state level advocacy around oral health impact advocacy at the national and federal level? We are one of those states trying to become one of those states that has expanded adult dental and Medicaid. We're looking at the opportunities in the marketplace. How does our state advocacy around oral health policy impact the national and federal level landscape?
Well, I'll say, as somebody who works for a national organization, states really are often the place where there's sort of a testing ground for innovation. And, innovative state policies are often the inroads to broader federal policies. And so this is true, I think, both with respect to policies that actually get passed and implemented at the state level, but also true in terms of just sort of feedback loops. So as an example, the new regulatory changes that would allow states to add adult dental services to their essential health benefits framework, it was really the result of states and advocates for a long time lifting up the fact that this prohibition was interrupting their ability or their desire to address oral health access and coverage and equity. Just as an organization, we had been hearing for years from people about how this was sort of tying the hands of states, and how it was one sort of piece of advocacy that oral health advocates wanted to push for that they just couldn't because there was this prohibition in place. And so I don't think we would have seen those broad federal changes happen without people from the state level sharing on the ground experience about the actual impact that was having on access to care. I would say, to your point, Matt, another relevant example is the huge progress that we've seen over the last several years on states expanding their Medicaid adult dental benefits. The broad uptake from states, I think, is really a big part of what helps make the case for federal standardization and just helps us know what a comprehensive benefit could or should look like. And I think, again, too, from the perspective of somebody who is working on advocacy at the national level, no one entity is ever going to be the expert on the context in every single state. And so hearing from state advocates and understanding what's important, what you're working on, it just really wouldn't be possible to do good federal advocacy without that. And so even from from an advocacy perspective, having that inroads into knowing what's going on in the different states and what's coming up from communities about what people need is really, really critical.
I think, well, I just want to piggyback on that as well, because I think that is honestly one of the most critical things, having those inroads and being able to make connections and learn from one another. So if you haven't heard about Open, that is one place where you're able to make those connections and really connect with people that are interested in similar things or working on similar things. So one way that we are able to move that in a strategic way through Open, we have what it's the regional committee, and that's where we have the state representatives as well as the grassroots representatives, and they're led by regional leads. And so monthly they'll come together and really start talking about like what are the different issue areas that are going on in states or within communities, and be able to learn strategically from one another. And we know that through not only the Hill Day and annual advocacy campaigns, that advocates are building relationships with their legislators as well, and supporting the development of viable solutions within states, and taking what they've learned through other states, through those connections with other Open members or stakeholders that they're connecting with on anything from what's worked well, any pitfalls, best practices, lessons learned. So we also have a large focused on framed messaging and really a large communications focus. And so one thing that's been lifted up through the regional committee is the focus on conservative legislators, and how can we really message things that are going to appeal across the board, across the aisle. So Kansas, they have been finding success with demonstrating fiscal savings of preventive services, of creating jobs, also framing Medicaid expansion. Instead of saying expansion, they're saying that they're extending the adult dental benefit and finding a lot better resonance. So that could be something that's useful for you all. One more thing is that the conversations around oral health, they've been growing consistently at the federal level through the last, 3 to 5 years, but really growing and seeing that. So we did see oral health in Medicare considered and nearly passed pretty recently. And I think now there's a greater understanding of disparities and the financial impact of just having a system that operates the way that it does. Particularly now since COVID, I think that there's been a greater awareness that's been built, and understanding the emergency department costs and the savings through expanding access to prevention. But I will pause there because I could tell you so many things, but I will make sure that I leave room for other folks. So thank you.
Sure, I'll try and piggyback off what everyone else has said and maybe shake it up with my like weird academic hat. because everything you guys have said is so true. And I think the big picture is that there is no federal policy without state policy. Like, where are we going to get the ideas if it isn't from our communities and our neighbors and the states we live in? And in addition to thinking about the state level, I think one thing that's really important in oral health is also the tribal level, because so many tribal nations have made amazing advances in oral health in ways that states have then adopted. I think probably the best example is the dental therapy program that was started by the Alaska Native Tribal Health Consortium, spread to in the rest of Alaska, and then was adopted in Minnesota, and now in lots of other places, including in Arizona. And those state laws really gain traction, both because of Indigenous advocacy and also because of demonstrations of effectiveness within sovereign tribal nations. So I think that that's like a really great example of sort of the best case scenario of how we can take our own local advocacy and our own knowledge of the communities that we work with and serve and use it to make things better sort of on a bigger level. And though we still have a ways to go in that particular avenue. The other thing is that all of these quirky state policies that can be super infuriating at times and represent like so much hard ground fought by advocates like you guys are one of the best ways that I have as a researcher to actually evaluate why oral health matters and prove it to lawmakers. I'm not saying that I wouldn't love to wave a magic wand and have there be a Medicaid adult dental benefit in every state. Believe me, I would. But if every state is going to have a little bit different Medicaid program, believe it or not, that's actually an amazing way to quantify why having comprehensive adult Medicaid dental benefits is really helpful. So the sorts of changes that get made incrementally by these very hard fought battles at the state level can then be used to provide really potent, both quantitative and qualitative evidence to speak to federal lawmakers and to the policy wonks that don't get elected but quietly do all the work behind the scenes to make this happen.
That's awesome. And just adding, in Arizona, we've also worked quite a bit with the Arizona Advisory Council on Indian Healthcare. One of the things in our last gubernatorial administration that I think they were able to go along with was taking the dollar limit off of emergency dental for the tribal populations because it's 100% federal. So it's interesting the extent to which people are willing to show support until it comes to money. But I also found it interesting talking about Kansas and some of the other states. I was many years ago part of a messaging group that was working on trying to expand the children's health insurance program. And I remember Kansas was one of those states where Missouri had just expanded. So they used if Missouri can do it, so can we. So I think it shows how helpful and powerful it is to work across states. So what opportunities do you see to better connect state advocacy with federal advocacy or other states? How might advocates help support the federal and national work?
So I can start with some things that anyone interested can do like right now, today. So like as a part of the hearing that Senator Sanders and the Health Committee had yesterday, Senator Sanders, I believe on Twitter, put out a call for oral health stories. He received over 1,000 responses, but there is room for more. And I think one of the things that is always the most difficult about our oral health concern is that there is a huge stigma associated with having poor oral health that we're all trying to fight. But it means that patient voices are often missing from the ways we advocate, or they're secondhand. So if anyone wants to kind of contribute to that storytelling, I think that is a really important thing that you can do like today on Twitter, like right now while I'm talking, like open up a second screen or whatever. The other thing that you can do right now today that I'll just put a link in the chat to is that the Federal Register, which is like, I guess the newspaper for the federal government sort of, is also the place where they post announcements where there are requests for commentary. And that means that literally anyone, any citizen can write a letter or a comment or something like that, and it will be made a part of the public record for consideration. Now until May 29th, there is a comment on Medicare Advantage, which is the private form of Medicare that most people on Medicare are now a part of, and which claims to have a dental benefit, yet doesn't actually provide more dental care than regular Medicare. So if this is something that you care about, if you are working with people in nursing homes or older adults or people with disabilities who are receiving their benefits through Medicare, and you want to write about the need for better evidence for oral health within these programs, this is another thing you can do, like sitting on your couch while you are as a part of this conference if you wanted to. So I will put that in the chat as well.
Thanks.
The other thing I might put a plug in for is that there are also so many opportunities to connect not only state to state or state to federal, but across issue areas, either within a given state or with neighboring states, because we know that oral health is health. We know that there's a deep connection to other chronic illnesses, to whole body health. And so there are, I think, a lot of opportunities for working together with other healthcare advocates, people who are working on improving access to care for people with disabilities, for substance use disorder services, and really any host of other issues. We know that oral health has such a strong impact, and that people who are not focused on oral health may not be thinking about that. But if our voices as oral health advocates are at those tables, then it's an area that that I think when it's brought up, people show a lot of support for. We recently did a round of polling and found that about 70% of voters said that they would feel more favorable toward a policymaker that would support making dental care more affordable. This was one of the most popular policies, I think, second, and a very close second only to addressing medical debt. And obviously we know those two things are deeply related because dental bills are a big part of medical debt. Only 5% of people said they would feel less favorable toward a policymaker who held that stance. So these are really, really popular policies. If you speak to individual people, if you speak to community members, people understand how important their oral health is. They know the consequences of not getting access to care because they're experiencing it, and they live every day trying to access a system that just isn't really meeting their needs. And so I think sometimes the gap between what people really want out of the healthcare system, what they need, what they think is important in terms of policies that need to be advanced versus the policies we actually see, especially at the federal level, it's a really big gap. And pointing that out is particularly important, especially when we think about the fact that these are policies that have really broad support and there's really not a ton of downside. There's not a lot of people saying, oh, I would absolutely hate it if my legislator or a policymaker made dental care more affordable.
And yeah, I mean, in complete alignment, and I think it's incredible to see how much amazing work is going on out there, and knowing that there are so many things that folks can do to take part in it and help to advance. So again, I will just encourage you to join Open, and I did drop in the chat, or I think it had to be reposted because I sent it only to the hosts and panelists, but so if you join Open, you'll have a connection point to be able to virtually subscribe to all the different things that Open puts out there. So you know, just kind of anything that's up to date info or resources to be shared. Folks are posting those all the time. We also have monthly advocacy committee meetings that will be starting again soon. We have an annual advocacy event, which will be taking place sometime August or September, and then an annual meeting that typically happens towards the end of October. But it's a really exciting time for Open. There's been some movement over the last few years, but this year we have a member engagement committee that will be really focusing on really taking what the grassroots folks have been hearing from their communities and lifting up what are the changes that folks actually want to see, and what are the different ways that we can start to work together to advance those. Hold on, I just lost my train of thought. So I know through the different advocacy things, we offer training on how to engage legislators, how to establish state advocacy visits for members. I think I already mentioned about the 3 different policy asks that we'll typically land on as a network. And so members that participate over time have really strengthened their skills through these capacity building workshops and built some valuable relationships with the legislators in their states. And one thing that we're really focusing on is oral health is connected to overall health. We know that. Not everybody knows that, right? The mouth is a part of the body, and being able to connect it to diabetes and to substance abuse issues and to a whole range of issues across the lifespan. And folks that are working in different sectors that are really strong advocates in those sectors, it's really about like expanding how do we connect the mouth back into the body? How do we, connect oral health back to overall health and make the case that this is all interconnected and this is something that oral health needs to be included within the conversations. So there's a number of other issue areas that are moving forward that I think folks can take part in. There's a huge focus on workforce expansion, diversifying the workforce. Also, a lot of states have been considering the dental hygiene interstate compacts, which I think Kasey might have mentioned a bit earlier, but there's a lot of movement where states are learning from one another. How can we eliminate this, the commercial product sales tax that's on these products and try to alleviate the burden in another way on consumers and on communities. I think the last thing is a lot of attention is being paid on states that do have Medicaid expansion, and some states are even going further than that to increase their reimbursement rates. Some haven't done that in 20 plus years, so it's exciting to see. But there's also not necessarily an uptick of providers enrolling in Medicaid that you would assume would match the increased reimbursement rates. So there's a lot of focus on learning from states that are beginning to increase the enrollment rates. What are they doing? How are they connecting with providers? What kinds of things are they doing to address fears, eliminate biases, and really strengthen the education on how to work with Medicaid itself, Medicaid populations. Disabilities populations is another thing for really practice change and how can we support and learn from one another. And so I really just once again would encourage folks, join open communities. That's the easiest way to get in. Post something or connect with somebody, join an open event. And I mean, I think if you ask any open member in this room, and there's quite a few of them that I'm seeing in the chat box as well, but I think it's one of the most inclusive, welcoming networks, groups of people that really are trying to change the world and lifting up oral health as one of the most critical issues that we can be focused on. So please do. And let me know if you have any questions, and I will throw my email in the chat box as well. So I'm always available for any kind of network support.
Thank you. We have a question in the chat from Jan Gruzius. FYI, Arizona State Rep, her, and the Arizona Grassroots Rep, Jen Dangermond, are on the Zoom today. Would love to hear from the panelists about how we can leverage open to support Arizona. I know that was, not sure if that has been fully answered, or Jan, if you want us to talk a little further about that. I don't know if anyone has any additional thoughts beyond what we've said on open. Sounds like there are a lot of comments in the chat about how helpful it is. If no one else has anything to add on that, we touched a little bit on, oh, there's Jan. We did touch a little bit on the NBPP rule to increase access to dental care in Arizona. Is there anything that anyone can add on that? Would that be the rule that just came out regarding the marketplace?
Yeah, so states, as I said, states do have to take action, and it looks a little bit different in each state. So the authority for who actually gets the say in terms of making updates to the state's essential health benefits package is different in every state. Some states require legislation, some states don't. In any case, for states that would want to add adult dental benefits as an essential health benefit, you would have to go through the benchmarking process to update the benchmark plan. It can be a little bit of a tedious process, but this rule also included some other administrative simplifications to try and make it a little bit easier for states to do that. And, typically the first step would be to reach out to whoever the decision maker is and start moving some of that advocacy to get them to do it. But before that, you have to identify who the decision maker is. And I have learned that that is a much more complicated question than it sounds like it should be. I made the mistake of asking that question thinking I was going to get a simple answer, and that was not the case. So as I said, I can drop in the chat or share afterward also a couple of resources that Community Catalyst has. I think this is a place where many of us are kind of building the plane while we fly it, or whatever the saying is. There are a ton of question marks. Matt is maybe laughing because we were on a call together and he's probably hearing me say the exact same things that I said yesterday. There are a lot of unknowns. I think probably some states will have to try some things and see what works, because it is totally new territory, which is good. It's new territory that we want to be in. And also there's just not really much of a precedent, definitely for states adding adult dental as an essential health benefit, but just having a comprehensive benefit with no annual or lifetime limits, which there can't be for essential health benefits, but we know that most dental insurance does currently have annual and lifetime limits. So we're entering kind of a new phase of adult dental, particularly in the private market, which is really good and really unknown. So that's a really long non-answer, but I'll drop some resources in the chat, and definitely encourage folks to keep an eye out. We'll have some more resources. We have some ongoing strategy calls that we're pulling people together to just talk through some of these implications and see what this will actually look like in practice.
And I did have a brief exchange with an advisor in the governor's office late yesterday, and it is on their radar screen here in Arizona. What exactly we have to do to make it happen, or what the impact would be, or how it would be structured, is still something that we'd have to have quite a bit of discussion on. But we're certainly beginning those advocacy efforts here, and I think it's going to be important for all of us to talk to each other as well within the advocacy community to kind of get on the same page. Jan, I know you had a question, and I see you are on and off muted. So do you want to ask?
I don't know if it's a question. I think it's more of a comment. So those of you that do know me know that I've been with Open, previously Oral Health 2020, since the inception. And it's gone through a lot of changes. But one of the things I really want to add to Francis's rah-rah, come join us, is just the people that we're partnered with, that we do work with all the time, like Community Catalyst, like other Families USA, other big advocacy groups. And, there's an awareness of how different every state is legislatively, but there's also pieces that were the same in those organizations, plus Open, and now with this new regional leadership committee, are going to be able to tie that information together much easier than just us as Arizona going out trying to find out, what everybody's doing. The changes are like all the time. So again, I want to say to contact me and or Jen. And we just actually had our first regional leadership meeting like a couple days ago, or yesterday, a couple days ago. So there's a lot of new energy. I think I've been doing this at the national level mostly the last few years, but this year I did participate in Open's Capital Day, which was, I don't know, you can tell me when it was, Francis, but I was able to talk with both senators, aides, and they were thrilled. They were thrilled to talk to me and find out about oral health. So making that connection with not only the federal legislators, but Matt's very familiar with, having good contacts with our state legislators. And somehow I would love to see that connect. Not just two separate things. So again, I'm hopeful. Okay, Francis has told me it was September of last year, and it was great. I mean, it was great. We had great, I don't know if it was community catalyst. Somebody actually made our packets, you know, for everybody across the country because we were talking on the same thing. And it was easy. It was easy. So I want to get more people involved. I want to get more people aware. That's where it's at. So I guess
Thank
that's my question. How can we do that? You know, there's other things I could put in the chat, the American oral health, the group of all the oral health coalitions across the country. There's a group and they do great work. So let's make sure everybody gets to the table, or at least in our awareness of who's doing what. So
That's awesome. Thank you, Jan. And I know that was one of the things that Brianna had put into the chat earlier, was what other advocacy has been done by those of you who are on the Zoom meeting today. If anyone has any stories you want to share of advocacy you've done or ways you've been engaged, what you found helpful, you know, feel free to let us know, whether it's at the national level or at the state level. Feel free to raise your hand. And actually, I just heard that we might have just a couple minutes left here. So anyone else want to have any final comments, closing comments, anything from our panelists?
I'll just thank everyone for being here today. It was great talking with you, and I feel like I learned so much from our panelists too. So thanks, you guys, Kasey and Francis and Matt. It's lovely to be on here with you. I'm going to put my email address in the chat. Please know that while I am in Massachusetts and very much, unfortunately, not in Arizona right now, I am so happy to be supportive of anyone's efforts. And also, if as people on the ground doing the work, you notice things that you would like to elevate to a broader level or would like assistance in evaluating, I think that is one way that people working at the federal level like us can hopefully be helped to advance the same goals that you were all advancing. So rather than just thinking about the ways in which we can have you impact federal policy, if there are ways that we can support you in the work you're doing, that's also really important. So I'll put my contact there in case it's ever helpful to anyone.
Thank you. Any other closing comments?
I'll jump in and say ditto to so much thanks to everybody and to my fellow panelists and you, Matt, for making this such a wonderful experience. But so thank you, Jan, also, and Jen, I see you as well, the state and grassroots representative for Open who are there within Arizona. There are a number of Open folks as well, and one of the things on Open Communities, whose web addresses I had just dropped into the chat, but you can actually search the directory there and type AZ in the state, and then find all of the Arizona advocates and stakeholders and everybody that's within the state. If you have any questions, I will also put my email in the chat if you're looking for any resources. But I do encourage you all to stay connected and stay energized. This has been wonderful for me to do that. So thank you.
I will
And
just
folks-
add my thanks. Oh, I'm sorry.
Oh, I'm sorry, Kasey. I just wanted to say, we actually do have a few more minutes for questions if you all have some more. I am on East Coast time and like getting confused, so I apologize for that. But we do have about 5 more minutes if you all want to continue the conversation.
Well, I'll still add my thanks, but I won't I won't reserve the last word.
Excellent. Anyone else have any final comments, questions, thoughts in our remaining 3 minutes? I don't want to get us too far ahead of schedule and make anyone have to do song and dance numbers if we get too far ahead.
That's funny. I do have a question for the panel. You know, I've been in public health for multiple years, and you know, and we're going to have the FQHC panel on as well. But some of the challenges that I've seen in FQHCs is just the funding that's coming in for them to be able to just even exist in the dental programs. Is there stuff happening at the grassroots level to help some of this funding to come? Because a lot of times what makes a federal qualified health center work better is if they have a robust pediatric department. But if they don't, you know, and we're seeing a lot more adults because maybe clinics in Sun City where all the adults are, what kind of things can we do to help with this kind of, you know, what can we do in the grassroots part? Thank you.
Anyone want to answer that?
I think you're getting a lot of silence because it's such a tough issue, right? Like this is the ultimate challenge of community health: no money, no mission. And often dental is the loss leader. Like every health center I've ever been a part of, the dental clinic has lost money and has been subsidized by the other services. So, you know, I think that is a huge challenge. And I think sharing that fact is actually really important for lawmakers. At the Senate hearing yesterday, multiple senators talked about FQHCs in glowing terms. I think they really see these as beacons of healthcare for the community, but they don't understand the ways that the finances are so strained. And often the discussion was like, oh, it's almost justifying that private dentists didn't need to accept Medicaid because FQHCs existed. So I think like tearing that Band-Aid off and like making that known, that financial reality known, is really important. I'll also note that the Comprehensive Dental Reform Act that Senator Sanders is proposing does include an earmark for HRSA to provide additional FQHC funding, including for dental residency slots. For a lot of reasons, I think that's a really great idea, but from a financial perspective, it certainly benefits FQHCs. So that's another specific piece of advocacy, at least for federal policy change, that could directly benefit communities and FQHCs.
And I will say on the FQHC side, having come from that world here, it was a lot more easy to do when you have Medicaid reimbursement for children, because just want to reiterate that dental is part of the PDD benefit for children and youth. But you know, if you're an adult who does not have dental insurance, trying to find services in the state of Arizona is very difficult, and some community health centers do provide that. But you know, hopefully, as Dr. Simon said, you know, they try to make that up on some of the other areas of providing medical care. So if you do go to them for a discounted dental care, I'm sure they'd appreciate it if they if you could see them as a medical patient so they can bill your insurance there. And in Arizona, our health centers do have been pushing. In California, there was a lawsuit, and I think it's found its way here, where federal law actually does talk about health centers getting reimbursed for dental care. And so that is something that perhaps if that lawsuit goes the right way, we could at least see federally qualified health centers be able to get reimbursed for adult dental, which would open up a lot more services. So with that, we are at time. I want to thank all of our panelists, and we have some very, very helpful resources in the chat. Thank you, everyone.